In this video we'll be discussing about the anti-emetic drugs. Now emesis is basically vomiting. Now two phenomenon associated with vomiting is diarrhea and nausea and diarrhea. So a simple mnemonic to remember these drugs, the anti-emetic drugs, is pros get nausea and diarrhea. Now the highlighted words represent the classes of drugs. The first is pro. Now pro stands for prokinetics, and remember the term metodome, metoclopramide and domperidone. So this is the first class of drugs called prokinetics. The next is N. N stands for NK1 receptor antagonists, and these drugs, they end with the term prepitants. Now the examples of NK1 receptor antagonists are aprepitant and fosaprepitant. The third drug is the S is modified into 5. So we have 5-HT3 antagonists, and these drugs end with the term cetrons. So we have granisetron, ramosetron and ondansetron. So these are the 5-HT3 antagonists. So remember, granisetron, ramosetron and ondansetron. The fourth class of drugs is anticholinergics. So the examples of which are hyoscine and dicyclomine. Coming to diarrhea, the highlighted letters are D, H and A. D for D2 blockers, and remember these have the term chlor in it. So we have chlorpromazine and prochlorperazine. The sixth is H for H1 antihistamines, and the examples are diphenhydramine and promethazine. And finally we have adjuvant antiemetics, the examples of which are dexamethasone and benzodiazepines. So remember the code for antiemetic drugs, which is pros get nausea and diarrhea.